All right, well, we're here with Dr. Yaeger today. Dr. Yaeger is attending the in-person training here at the Huntsville Imetric train location. So, Dr. Yaeger, thanks for joining us.
Oh, it's great to be here.
Why don't you go ahead and start by just telling us a little bit about your practice and where you're based out of and all of that good stuff.
Yeah, I practice with my wife and our incredible team in Richmond, Virginia. We have a comprehensive dental practice. We do cosmetics, sedation, implants, and we really try to cover the whole spectrum possible.
Fantastic. So obviously you're here for your ICam training today with the team. So thank you for bringing your team members along. What was it about the ICam that kind of first caught your interest and why did you look to implement it into your practice?
Well, the ICam has the longest track record of any type of system like this, and we've been exposed to it for a few years. But for us, the efficiency and then the reliability of the data is very important. So our goal is to minimize the visits for the patients and then increase the confidence in the results that we're getting.
Fantastic. So you were telling me before, how many times have you used the ICam so far? I think you've only had it a couple of months, but you were saying 20 plus times?
Yeah, we got ours in September. We got the newest version, and we've used it, about 25 times.
And how has the patient feedback been now that you've been treating them for a number of cases with the ICam?
Yeah, the ones that remember what's going on, they think it's pretty cool.
Okay.
To actually see a little bit of that portion. But what I think the patients are really enjoying is the reliability of the results.
In terms of the number of visits that they have to have and the outcomes and things of that nature?
Yes, and we've also been able to use it on cases that aren't new cases, maybe cases that have had hybrids for many years. They've got a lot of delaminations and problems now, and maybe we're making a new prosthetic for them. But instead of it being a very multiple visit, a long treatment period in order to get them into that final restoration, for them to have a prototype restoration after a single records visit, they find that pretty impressive.
Well, that's fantastic. I mean, I've always said to the Imetric team, at the end of the day, our true customer is the patient, right? So that's very, very important to us. You mentioned a moment ago efficiency gains. Tell me a little bit more about that and how that's helped with your workflow.
If you compare the traditional workflow, which is how we were all initially trained, you have an impression, you have a verification jig, and then you're going into some prototyping phase. The ability to be able to skip some of those points and not snowball a lot of errors, I like to think of it as human touches. So anytime that you introduce a human touch on anything, you have the potential to incorporate error. And anytime that we can remove that potential error, we're more likely to have a consistent result in the end. So it makes it, I can sleep a little better at night knowing that I'm working with data rather than something that might have heat tolerance, may have metal fatigue, other things that could be a real issue in the laboratory setting.
Yeah, that's great. And obviously you've brought your team members here to Huntsville for the training today. How have they taken to the ICam, and what has their experience been with the new technology?
Oh, like a sponge. Our office is called Inspired Smiles, and it's really become what we like to name it first, but it's really become what we believe in, and creating that inspiration for our team to maximize their potential. And anytime we have new equipment, new technology, software, other things, they get excited about it. They're very happy to incorporate it, and it's been really wonderful to see.
That's fantastic. So last couple of questions here. What kind of impact has the photogrammetry technology and ICam had on the number of procedures you're doing? Obviously, you're more efficient, you've improved the patient experience. Have you seen an increase in the number of cases you've been doing?
Absolutely. Yeah, because I can remove some of the hesitation within scheduling cases. I know that if I get a product a result that I'm not confident in, I know how to quickly troubleshoot it. And I know that's something that comes in maybe an older workflow, and now I can incorporate a newer workflow. Prototyping in that situation and an analog workflow may take weeks at a time working with the laboratory. Well, now we can get the data and we can prototype within 24 hours.
Oh, that's fantastic.
So a large barrier in really all scopes of dentistry is, well, how much time do you have to rely on processing to get that patient back and get them into a stable position. So the more that we can minimize that, it's not just scheduling efficiency or productivity, but it's also about minimizing inconvenience for our patients.
That's fantastic. So last question, what would you say to any other doctor out there considering ICam? What would be your kind of feedback or your experience with the technology today?
I would say I don't think I'm the earliest adopters of the technology. I like to see them in practice. I like to see people using them, but I feel very strongly about this product in particular because I know that it's, from an engineering standpoint, all of the technical specifications are excellent, and how that is done is very good. I like the design of the ICam bodies as well. I like metal. I like having that surety, whereas with PEEK and some other materials, you can have deformations. You don't have tactile feel like you do with metal. So I think that's a major advantage that ICam has over the other systems. They all work, but again, how well do they work? How well do they work when the data is pushed to its limits, or maybe you don't have enough data to work with? But if you can ensure that you're giving your laboratory and your design team the cleanest data possible, then you're more likely to have a predictable result in the end.
Awesome. Well, thank you, Dr. Yaeger, for your time today. It was really great to hear about your experience with the ICam. So obviously, we're super excited to have our own hands-on training center here in Huntsville, Alabama, where Dr. Yaeger has brought his team today. Hopefully, we'll see you here yourselves very soon, getting your own hands-on ICam training. Thanks very much.